April is Oral Cancer Awareness Month, and I wanted to come on to help you to prevent oral and oropharyngeal cancer by discussing two main contributing factors that can put you at higher risk for developing oral and oropharyngeal cancer. One, which probably won't surprise most people, is smoking. And if you smoke and you consume alcohol at the same time, that can increase your risk of developing oral cancer even more because alcohol acts as a solvent that can bring in those carcinogens or cancer-causing agents into the tissues more readily. Now, I know information alone won't prevent people from smoking or help them to stop smoking. So if you are currently smoking, I find it's important to consider what role does it have in your life. Oftentimes it can be because we're feeling anxious or down. So how is it serving you? And what support do you need in order to replace its role in your life with something that can be more helpful for you? Now, one might think that developing head and neck cancer and being treated for it could be enough to help you avoid tobacco use in the future. However, because it serves a role and having cancer can be quite overwhelming and bring up a lot of emotions, individuals are at risk of going back to using tobacco products, which can increase the risk of recurrence or development of additional cancers. And if you do go back to tobacco use, even after you've developed a cancer, and you're considering, why am I not able to stop using this? I know it's contributing to harm. I'd look to see what role does it have in your life with curiosity, with compassion, without judgment, and saying, what support do you need in order to replace it and to prioritize your wellness? There's so much that goes into it. And I want you to know that your wellness matters, that your life matters. And it's so hard if you are experiencing a serious illness. And it's understandable if you are leaning in to something that felt like it was helping you to cope at some point in your life. So what resources may you leverage so that you can optimize your capacity to heal? Now, a second risk factor for development of oropharyngeal cancer is the human papillomavirus. Now, as it sounds, this type of cancer is associated with the human papillomavirus. The human papillomavirus has many strains, some that are associated with cancer and some that are not. There are studies that report that 80% of individuals who are sexually active will be exposed to human papillomavirus at some point in our life. But due to the fact that human papillomavirus is often associated with sex, many people don't talk about it or it's stigmatized. But we're here to talk about it. If you follow me around, you know that I was just diagnosed with severe cervical dysplasia, which was HPV 16 positive, despite being abstinent for over 10 years. HPV can have a latency period, and often it's cleared by the immune system. But for me and other people who have compromised immune systems, or for whatever reasons, for some people, it can stick around and contribute to the development of cancers in multiple locations in the body that affect individuals of all genders and sexes. Because HPV is ubiquitous and the majority of people will be exposed to it at some point in their lives, one way to prevent HPV-associated cancers is to get vaccinated. There seems to be quite a lot of vaccine hesitancy, especially around HPV and the discussions about getting it as children. However, as I mentioned, most people who become sexually active will be exposed to it at some point in their life. After we're exposed, the vaccine is not as effective, if effective at all. Studies are still examining whether getting the vaccine after you've already been exposed might help you to rid yourself of the strain. But for now, let's just consider that you want to get the vaccine before you're exposed. The benefit of getting the HPV vaccine as a kid for individuals of all genders is that hopefully you get the vaccine before you're exposed, when the immune system can develop a robust response and protect you from it when you're exposed in the future. So you will see that if individuals are given the vaccine early, they might just get 2 doses, and later in life, they'll get 3 because the immune response isn't going to be as strong later in life. I can't give you medical advice on the channel. I have gotten the HPV vaccine myself. I got the vaccine before I actually knew that I had HPV 16, but also at the same time that I had my pap smear. For individuals that know they already have some strain of HPV, it's important to know that the vaccine might protect you from the other strains. And as I said, studies are still looking into if it can be beneficial after you've been exposed to help you to clear the virus. So as you're considering how to protect yourself from development of oral cancer or oropharyngeal cancer, one would be to avoid smoking or to get support in learning how to quit smoking. The second would be to get the HPV vaccine. There are multiple other things in between that can help you to prevent the risk of oral or oropharyngeal cancer. And in order to have the best outcome, if you do develop signs of oral cancer, is to catch it early. So please make sure to have regular dental appointments because the dentist will not just look at your teeth. They're there to look at your whole mouth and also the lymph nodes to see if you have any signs that might be suggestive that you have developed precancer or cancer. So if you have any further things that you want to discuss on oropharyngeal cancer, I can't answer personal medical questions, but questions that might be helpful for us to share with the whole audience, please ask those down below. I'm an oral medicine clinician researcher by training with a focus in head and neck cancer. My specialty is really driven to improve the quality of life and to support individuals impacted by cancer and their family with the psychosocial and spiritual aspects of having cancer, particularly of the head and neck. So please consider not smoking, getting support if you are smoking and are ready to consider stopping. If you are eligible or your children are eligible for the HPV vaccine, please talk to your doctor about the benefits and risks for you. And please make sure to visit your dentist regularly. So if you develop any signs of oral or oropharyngeal cancer, it can be caught early. Thank you so much for being here on A Mouth is Connected to the Body. If you found this information helpful, please share it with anyone else who may benefit. Prevention and early detection of head and neck cancer can save lives and drastically reduce the negative impacts that cancer and cancer treatment has on one's quality of life and psychosocial and psychospiritual well-being.